Good afternoon. My name is Tiana, and today I will be performing a nursing assessment on a 15-year-old patient. I've obtained written consent from my patient's parents. I've given my patient privacy to get gowned up or rolled up, as you can see. I've allowed him to cover any areas that we won't be assessing during the examination. I've also given him the opportunity to empty his bladder prior to the assessment. I have ensured that there are no safety risks in the examination area, no loose cords or anything that could potentially harm my patient during the process of this evaluation. I have all the appropriate supplies needed for the assessment. I have my gloves, my pen light, my stethoscope, and hand sanitizer, which I will now use prior to the exam. Good afternoon. I'm Nurse Tiana. I'm going to be performing a nursing assessment on you just to assess to examine the condition of your health, okay? Can you tell me your name and date of birth?
Kai Hines, July 2nd, 2007.
Do you know where you are?
The hospital.
Okay, and why are you here?
For my nurse assessment.
Yes, we're just going to do an exam to just check your health condition, okay? So by him stating this, I could tell that my patient is alert and oriented times 4. He's aware of the place, purpose, person, and time. Take that back. Do you know what today's date is?
July 23rd, 2022.
Good. Now he's alert and oriented times 4 to person, place, time, and purpose. Okay. By his response, I can tell that he can articulate and verbulate clearly and appropriately for his age. Do you have any allergies?
No.
Okay. Do you have any pain at this moment?
No.
Okay, good. Just by examining him right now, I could tell that his skin color is even and normal for his ethnicity. I've taken a set of vitals from him, and his vitals are normal and within normal limits. He appears his stated age with appropriate height and weight. I have my patient in an upright sitting position for the first part of the examination so we could examine the first part of the assessment. Right now, I'm going to observe my patient's head and neck for any abnormalities or anything that is not normal. I'm feeling for any bruises, bumps, or abnormalities on his head. His head feels round and symmetrical. I am feeling his lymph nodes, and for any swelling or edema, seems symmetrical and normal. His skin color is normal for his ethnicity. He doesn't seem to have any wounds or any abnormalities on his face. All right, you look at me. I'm checking his pupils. Open up, please. All right. All right, his pupils are equal and round and reactive to light, which is a good thing. All right. So now I'm just going to check out his ears, his mouth, and his oral cavity, and his nostrils, checking his mucous membranes for any type of conditions that are not normal. All right, open your mouth for me, please. All right, his oral cavity seems to be normal with no abnormalities. All right, I'm going to check inside your nostrils. Please look up for me. Okay, so he doesn't have his mucous membranes are pink, not swollen or anything. I'm checking his ears for the same. Okay. All right. Nothing bad about the ears or the mouth. Now I'm going to assess my patient's skin temperature, which is warm and normal or dry. I'm going to test his radial pulses, which, if you can turn this way, All right, here on the outside of each wrist. And I'm going to assess those pulses for 60 seconds. All right, 60 seconds have elapsed, and I have 78 for the rate. And you assess those pulses for 1 full minute. All right, now I'm going to test for your strength. So I just want you to grab my hands, both, or grab my fingers actually, with both hands, as tight as you can. All right, so his strength or grip feels strong and even. All right, you can release. Now I'm going to check his capillary refills, and I'm going to check each capillary refill, meaning each digit I'm going to squeeze and watch for the blood return back, and that's less than 2 seconds for each digit. All right. All right, and his is less than 2 seconds. Okay. All right, next I'm going to check the range of motion for my patient on all of his joints. Okay. All right. All right. Can you push against my hands with both hands? All right. He has equal bilateral or equal strength bilaterally. All right. Can you, all right, push your leg up against my hand. Keep pushing, keep pushing, keep pushing. Push up. All right, now try to bring your leg down. Okay, do the same thing with this leg. Push up against my hand if you can. Up, 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 up. Okay, now pull down. Good job, good job. All right. All right, now I'm gonna have my patient close his eyes and I'm assessing for his sensation. Wherever I touch, you tell me where you feel it's the sensation of touching, okay? All right.
Right leg, left shoulder, left leg, right shoulder.
Awesome. Next, I'm going to assess my patient's apical pulse, his chest and lungs. And while I'm doing that, I'm going to observe his spine and his back as well for any physical findings that may pose a potential threat. So we check for the apical pulse by locating the midclavicular line, which is right here, okay, and intersecting that with the fifth intercostal space. So approximately right here is where we're going to assess for my patient's apical pulse. And I'm going to listen to that pulse for 1 full minute. Okay, 1 minute has elapsed. My patient's pulse sounds strong and normal, accounted 78 beats per minute. Okay. Also, sorry, gonna assess. We're gonna look for any changes. I'm gonna any abnormal findings. His skin looks normal. I'm assessing the turgor. Also, that lets me know if my patient is hydrated or dehydrated. His turgor is elastic. He has no bumps, bruises, wounds, or contusions or anything on his back nor his chest. His chest looks symmetrical and even. His skin color looks good, normal for his ethnicity. All right, so now after I've observed it, his chest and his back, I'm going to go ahead and I'm going to go ahead and listen to his lungs. He's sitting in a supine position, which is the ideal position for assessing his lungs. And when assessing his lung, we're going to start in the back of posterior, then we're going to go laterally and then anterior when I listen to his lungs. Okay. Arms up for me, please. Okay, arms down. I'm just gonna listen up here. Okay, so his lungs sound clear and even, a normal, strong rate. Next, I'm going to assess my patient's abdomen. So I'm going to have him in a supine position for this part of the assessment. All right, so now I need you to lay down. Huh? It's still going?
Mm-hmm.
Oh, shh. Okay, next I'm going to be inspecting my patient's abdomen for shape and size and abnormalities. All right, in each quadrant. So, of course, his abdomen looks flat, a little round, and it's soft and not tender. So we're going from each quadrant. I'm slightly pressing down to check for any swelling, any lumps or bumps or bruising or any tenderness. So I'm going from each quadrant. Okay. Do you feel any pain right now? Okay, of course his skin is warm and dry. I had no findings from the palpating, of the stomach. Next, I'm going to auscultate or listen to his bowels to see what his bowel activity is. So my patient does not have any distension as well. Just to make sure I cover that, and it's non-tender. All right. So I'm listening for 1 full minute in each quadrant. 1 minute has elapsed. 1 minute has elapsed. 1 minute has elapsed. 1 minute has elapsed. He has normal sounding bowel activity present. So while my patient is still in a supine position, I'm going to assess his lower extremities. I'm going to palpate his skin for temperature and cap refill. The skin is smooth and warm. I'm going to test his capillary refills on his feet by pinching all digits like I did for the hands for capillary refill. Let me pause this. So here's the testing for his capillary refills of his toes. Okay, other foot, please. All right. All right. Capillary refill is less than 2 seconds, just like his hands were. Now I'm going to test for the strength of his legs. And before I do that, I'm going to observe for any edema or any bruising or stiffness or anything that's not normal in his legs. All right, do you feel any pain right now?
No.
No pain, no edema, no swelling, no inflammation, any of that, no redness. Normal skin color looks normal for his ethnicity. Okay, just like we had him in the sitting position, lift his leg. I'm also going to test his strength by having him kick your legs up against my hand, push, push, push. I'm just testing his strength. All right, and his strength in his lower extremities are equal and strong as well. Next, I'm going to check my patient's pedal pulses, which is located, if you can, lift your feet up for me just a little bit so I can show. His pedal pulses right here at the top of his foot for 1 full minute. All right, 1 full minute has elapsed, and those pulses were strong and normal. I'm also going to test his pulses. If you could lift your leg up for me a little bit, right here, his popliteal tibular or posterior tibular pulses for 1 full minute as well. Okay. All right, 1 full minute has elapsed. He has strong pulses right there. I would rate them a 3+, as well as the radial. As well as the pedal pulses. All right. Okay, so we are just about at the end of our assessment. So today I performed a nursing assessment on you. Can you tell me why I performed a nursing assessment on you?
To know if I'm healthy or not.
Okay, so, and according to his assessment that we just performed, in a nutshell, he is healthy. He had no abnormalities or no concerning issues at this moment. But if there are any issues or any indicators that you notice, such as if you notice any swelling or any pain or anything like that, what would you do in those instances?
Report it to my parents and the doctor.
All right, so he understands that he will report any changes or abnormal findings or anything that is different from what he has been assessed on today, that he knows to report that to his parents or to his doctor. So he is a motivated young man who is actively engaged in his health, who understands that his health is important and that he'll participate in staying that way. So make sure that you do the right thing, eat the right things, and report the right things, right?
Mm-hmm.
All right, so this concludes my assessment. Thank you.